So through the process of myself, right? Self-sabotage and depression. Being a suicidal man, I knew I couldn't commit suicide. My best friend had just taken his life in a very traumatic way. And I couldn't put my family through that pain. But what I was doing was completely headed down that same road, just in a slower method.
Yeah.
How do the two correlate, and how are you helping that, correcting that with PRTMS?
I think the most common denominator I see amongst our suicidal patients, or those that have had a history of that, is terrible, horrible sleep. You've got to fix their sleeping pattern first. They usually have very disruptive patterns of sleep. So I always start them off saying, we have got to get you back on a circadian cycle, getting morning sunlight, going to bed at a proper time at night, at least trying to. And then the next day when I try and treat those patients, we're moving a system that ideally had some sleep, and that neuron will listen.
Okay.
If you don't give your brain sleep, it won't move the following day when we try and treat patients. So we really focus heavily on starting good hygiene for sleep and getting patients trying to, even if they require medicine, the timing of it's important to get morning sunlight, which activates the HP axis and suppresses melatonin.
HP axis
is the hypothalamic pituitary axis,
okay,
which makes all your hormones. And one of the suppressatory effects is on melatonin, reducing that amount, which then at 12 and a half hours or so peaks. So 9:30 at night, you start getting a very sleepy pattern, which we want to get you down during that period. So
okay.
that's a key thing. Try and regulate the sleep with those patients. There's a lot of self-medication going on. And so we don't oftentimes tell our patients to stop self-medicating. But if I start to bring down the anxiety, they will stop medicating less.
Yes.
And this has happened over and over again for our addiction patients. They don't have the cravings because the brain's being corrected electrically. So they don't need the same amount of medication to self-correct it. And that where it took 5, 6, 7 drinks to have a calming effect. Now maybe 2 drinks have a calming effect. So you start seeing less self-medication without even trying for our patients. That's very rewarding.
Okay.
I'd say that happens like frequently. So those are like 2 big steps.
Okay.
Can we get them sleeping? Can we get them medicating less? So we can start having some good dialogue in our conversations with these patients.
Okay.
They do need, of course, behavioral therapy and help from our colleagues in psychiatry, and we always have those patients, being seen by those professionals as well.
So for me, it wasn't. I never did the less and less drinks as I went through. That's not how that one went at all. That was one morning. No,
it just stopped.
Your brain is not doing that anymore.
Well, that's even better. I mean, that happens in some patients where they stop cold turkey, but I think what we see is just there's a paradoxical effect with the same drug when you have your brain balanced. And we're balancing your brain, ideally. If we do, then taking a medication takes you out of balance. People will say, I don't feel the same way now with those 3 drinks. It makes you feel tired or sleepy or groggy, where it used to just bring my anxiety down.
Right.
If I bring your anxiety down electrically, you don't need those same 3 or 4 drinks. Now you take them and you're going to go slower and get tired. So patients will just start saying, I don't need it. I don't need that extra shot or whatever. So that's kind of a nice self-regulation thing we see in our patients.
Okay. Awesome.
We do our best. We're not always successful. We do our best with those patients. But
hey guys, I know you guys like that content. Do me a favor, drop a comment below. Let's engage. Let's talk TMS. Have you done TMS? Have you struggled with depression? Is there other topics you would like me to cover on this channel in regards to TMS, in regards to depression, anxiety? Let me know. Let's talk.